This podcast series is made possible thanks to the generous support of the Cooperative of American Physicians. Physician-founded and physician-governed, CAP provides superior medical malpractice coverage and solutions to more than 12,500 California physicians and helps them realize professional and personal success. Upon joining CAP, members receive risk management services, claims support, and a dedicated in-house defense firm, practice management resources, and so much more. CAP has been a long-standing premier LACMA partner and continues to support our members every day. To learn more, visit capphysicians.com. That's capphysicians.com.
Welcome to this edition of Clear as Mud, the podcast dedicated to bringing clarity to medicine. I'm your host for this episode, Dr. Jeffery Lee, the president of the LA County Medical Association. Greetings. We're at the 48th Annual Legislative Day to visit Sacramento to meet and engage with the state's policymakers. And today we'll be talking with over a dozen state assembly representatives. Our distinguished guest is Senator Portantino, representing District
25.
Thank you. Senator Portantino, can you just tell us a little bit about your district?
Well, I have the best district in the state of California, and that makes my colleagues upset, but I tell them I'm an honest politician, and I represent the best district in the state of California. It starts in Sunland, Tujunga, and goes across the 210 all the way out to Upland. Burbank, Glendale, and Pasadena are the three largest cities, but there's 18 communities along the 210 corridor, and I'm proud to represent it.
Well, great. We're trying to, obviously we're a healthcare organization with our physicians, and
the white jackets were a giveaway.
Yes. For those who are listening online, we've got our white coats. It's the invasion of the white coats today. So, but I just wanted to talk with you about some of your priorities for healthcare. We've talked a little bit before we started recording, so if you wanted to talk a little bit about that.
Well, absolutely. So thank you for the opportunity. This year we're doing a bill to make sure that women who have issues with abnormal breast diagnosis, that they get follow-up mammograms covered by their insurance. Right now they have to go out of pocket, which oftentimes they decide not to have the follow-up diagnosis. And then, of course, if you leave that to happenstance, bad things happen. And so we want to make sure that if your doctor wants you to have more imaging, and it's technology neutral, so as technology changes and gets better, whatever comes down the road is covered by your insurance company. And we think that's an important thing to do. It was brought to me by a constituent who had that issue and is also married to a physician. And so we thought it was a good thing to do, and so we put that in. And then we're doing some work on mandatory dyslexia screening. We should make sure that our first graders and their teachers know who has a reading challenge and who has a learning disability. And so we want that to be screened in all school districts. There's 38 states in the country that already do that screening. And then we're working with a number of advocates on fetal alcohol syndrome, children with fetal alcohol syndrome, to make sure that, again, their IEPs in school, that they get the care and the focus and the love that they need. So we're working on those three things.
Well, excellent. You've been very open about your health journey as well. I don't know if you want to share any of that with our listeners who are physicians and know kind of the process by and large.
Absolutely. So imagine me twice of me, 3 times. Well, not quite 3 times. Like everyone else, I put on 30 pounds during the first year of the pandemic and went to 314 pounds. And right now I'm 155. And so I had the bariatric surgery 17 months ago. And it changed my life at 60 years old. After spending 4 decades on a couch eating potato chips, I decided to do something radical, and so I had the bariatric bypass surgery. And so far, knock on wood, 17 months later, I ride my bike every day and went from, to put it in geometric terms, I went from a 3X to a medium, if you all are visual learners. And the one that gets me was 15 inches on my neck.
Wow.
5 inches on my neck.
Wow.
I lost 5 inches, so I went from a 20-inch neck to a 15-and-a-half-inch neck. That's pretty crazy.
You look great. So yeah.
I feel good.
Yeah.
My wife was upset because I had to buy all new clothes, and she didn't, a lot of new shirts. She didn't want to spend the money on me. I don't know what that's all about.
You mentioned the pandemic. Last question. How has the pandemic changed your view of healthcare as a priority?
Well, it's interesting. Obviously, like many constituents, a lot of my doctor's visits have been telemedicine, which has been fun. Though I will say that I've had one physician's office that they're never on time, which is a problem because, if I schedule my schedule, if I make my appointment at 11 o'clock, I'm not available at 11:30. So, but for the most part, the telemedicine visits have been okay for me. Some have been on Zoom and some have just been over the phone. But that's been a big adjustment because, I grew up in a generation where you went and you met with your doctor. But then again, society is so crazy and, life in LA is crazy that I don't mind not having to drive to an office. And so I've adapted to telemedicine. So I think that's probably been the biggest issue. And obviously, we've also seen how the pandemic has sort of exacerbated a lot of the social inequities in medicine. There are a lot of underrepresented communities, a lot of challenges, and I guess ethnic and racial disparities that have all been highlighted. And of course, the vaccine issue, the politicization of public health has been pretty sad. I mean, people are dying because folks are politicizing, which should be common sense. And I used to say that, a mask means you love your neighbor. It doesn't mean you're an evil person. It just means you love your neighbor. And we certainly should be loving our neighbors. And, that's what it is. I went out and I got a mask with hearts on it early on just to say, it's because I love you. You may not like me, but, and I had a friend who just had COVID and was wearing a mask in the line at the DMV, and some guy was not wearing a mask in front of him and was very indignant that he was wearing a mask. And the guy says, I'm wearing the mask to protect you because I had COVID last week. So, why we would politicize public health is just, it's crazy.
Well, Senator, thank you so much for being generous with your time. I just want to, you probably don't remember this, but when I was making my first trip here up to our annual Legislative Advocacy Day, you kind of took us and a bunch of medical students and went out onto the Senate floor and took pictures with us. We took selfies with you, and I thought that was just so cool. So I appreciate that. So thank you very much, and thank you for joining with us today.
Absolutely, and thank you all for being healers. We need more people to answer the call. So I appreciate your service and all of you for doing what you do. The pandemic's made it harder than ever.
Well, thank you.
Thank you. Thank you.